This is CBS 7 News Front Page, your eye on West Texas.
And it's Breast Cancer Awareness Month, but it's not only women who need to watch out for the disease. Coming up next, we'll discuss how often men overlook breast cancer and what you need to know to stay healthy. We're back right after this.
Certain cancers are linked with certain genders. And I think one of the biggest take-home points here for our audience is that men have breasts. And we don't always think of it that way. For instance, women cannot get prostate cancer because they don't have prostates. But men do have breasts. So you have breasts, I have breasts, everyone listening has breasts. So naturally, if men have breasts, they can get cancer of that breast. It's not as common, but it's common enough. About 2,000 cases will be diagnosed this year in the United States, invasive breast cancer in men, and 400 men will die from it this year.
Right. And of course, this is something that we obviously overlook a lot. What should men look out for? What's something out there that we can kind of look out for?
I think anything that's change. So if something is not the way it used to be, whether it's a skin change and the skin is turning a different color, if there's discharge coming out of the nipple, any dimpling of the skin, or any size changes, those are the main things. The other thing is just to be aware of risk factors. So the risk factors are very similar to in women. And when you categorize these risk factors, it's easier to remember which risk factors are preventable and which ones are not. So obviously, family history, genetics, we're stuck with that. We can't change that. But and aging, we're all getting older. Age is a risk. I wish I had a cure for that. We don't have that. But what we can do is maintain an ideal body weight, because obesity is a risk factor, and we can limit our intake of alcohol, because that's also a risk factor.
Absolutely, and of course, men probably don't often get screened for breast cancer. I don't think they need to. Why do you think that is?
Well, the main thing is the incidence of the disease is a lot lower. So where in women after age 40, there's a mammogram recommended every year, and if there's a strong family history, even as early as 25 years old, screening can begin. It's not common enough in men to screen everybody. So the burden lies on us to recognize if there is any change, like the changes I discussed, so that we can seek care and we can get a mammogram, and men do get mammograms to diagnose it.
Absolutely. All right, Dr. Sudip Bose of Medical Center Hospital, thank you so much for joining us today.
Thank you.
All right.